Thank you, Dick. And I did write my comments out because I have so much to say, and I think all of us do, and even if us could get up here at this point. Luckily, there's been a lot of education in the public, and that's due a lot to NIH and our funders who allow us to collect data so that we can put the story together, and to all the people who are already primed and ready to make a difference in this field because of our own lived experience. So bringing those two things together is what makes magic. And we all know, and you know, that what happens to you in childhood affects you throughout your whole life. It shapes and gets embedded in your brains and your cells and your beliefs and identities and your relationships and in your nervous system and digestive system and immune system and in your hopes and in your aspirations and in your DNA then, now, and in the future. And our sciences help explain this, and we live it every day and experience it every day and witness it every day. And we can also shift this by creating a culture that becomes aware of the requirements for its own well-being and creates a policy and practice infrastructure that can foster those requirements for our own well-being and end child abuse and neglect in our lifetime. So child abuse and neglect, oh, that was my opening slide, that you missed, takes many forms and is most characterized by the absence of safe, stable, nurturing relationships and environments that our brains and bodies, our hearts and our souls need to evolve in the natural way we were meant to evolve. And without that, we become unwell in a variety of ways. Nearly 50% of US children and about 2/3 of adults have experienced what we call adverse childhood experiences, which are experiences, not necessarily events, but experiences. We change through experience. And again, the science is able to help us understand the impact of this. By the way, I wanted to make sure I told you this is for children with one or more adverse childhood experiences. It's 2 times the width of the United States of school buses filled back to back with children with ACEs, and it's 1 time across the United States with 2 or more where we start to really see big effects on conditions, chronic conditions, emotional mental health conditions, school engagement, and other such factors. So our sciences are strong. I'm going to get my glasses on here a little bit so I can keep track. Explaining the neuroendocrine, immune, biobehavioral, social, emotional, and relational manifestations, which is a very important thing. These effects are what I call equally unequal. Once experienced, children with adverse childhood experiences are equally as likely to have a diagnosis of an emotional, mental, behavioral health problem using our national epidemiologic data, regardless of their household income. And so this is all of us. The effects on flourishing are equally the same in terms of household income once adverse childhood experiences take place. And school engagement is particularly affected, and engagement in life, being curious, interested, engaged in the things that we know help develop our lives throughout. And with lack of school engagement, we know our life trajectories are very, very impacted. However, there's things we can do. And what we can do starts with helping to heal that relationship between a child's body and their own hearts and minds. And we can actually build resilience for children, but we have to do that through our relationships with them. So it's very dependent on the adults in our lives. So this is a slide just showing that when children learn basic qualities of resilience, like being able to notice their emotions and their feelings and their breath and come into a place of regulation around that, that they're much more likely to engage in school even with the experience of ACEs. And it's a very dramatic effect. But we know that this is most dependent on the adults in their lives being able to be that resilient force for them. And we have a lot of evidence to show that that's not necessarily the case among adults and families in America who experience a lot of stress. So having an adult mentor or having families where they really prioritize sharing ideas about things that really matter. And these are some of the things we're able to measure and show the dramatic difference we can start to make. So the call for intergenerational approaches, the call for promoting healthy parenting is very, very strong, and Dr. Dubowitz is going to talk a little bit more about that. But with hundreds of my colleagues, we had the opportunity to map out a starting point agenda to promote child and population well-being by addressing ACEs and the social and emotional roots of well-being. It calls for multi-systems approaches that translate the science, that cultivate the conditions for cross-sector collaboration, healthcare, public health, child welfare, justice, schools, our businesses, to come together and to address the structures, systems, and services that actually often generate and perpetuate toxic stress and trauma rather than prevent and heal it. And that there's a million win-wins that can happen right now if we get started working together. Also key is to fuel launch and learn policy and practice efforts that begin now and learn as they go, which is a different way to fund research, a different way to fund what we do, and to create an era of experimentation that really takes as a priority restoring and rewarding for safe, stable, nurturing relationships and really getting really good about that. Those are the requirements for our well-being. So the good news is that we have many existing policies and practices that we can leverage and further shape. Policies like our EPSDT coverage and optimizing well child visits, school health, behavioral health and child-adult health integration, home visiting, and financing our systems in a way that solidifies the commitment to be able to promote well-being and innovate around that so that we can end and must make possible ending child abuse and neglect in our generation. Okay, so that's my summary, and to beauty, because it exists in all of us.